Okay.
Okay. Good morning, everybody. Thank you. Welcome to the Sedgwick County Commission staff meeting for today, January 19th. So welcome, and at this point, we'll turn it over to Tom Stoltz.
Very good. Thank you, Chairman and Commission. Good morning. And Mr. Dennis is on Zoom this morning, so we have you all here. Three items for staff discussion this morning. One will be a presentation from Lori Gibbs and Glenda regarding the Next Step program we will be using in corrections. And then we have two discussions. One will be vaccine update and legislative update, which will both take a little bit of time and be more of a conversation than a presentation. So we'll have Lori go through the presentation first, and then we'll move through the agenda.
Okay. Good morning, Lori.
I double check to make sure Commissioner Dennis is hearing okay. Commissioner Dennis, are you good?
Yes, I can hear. Thank you.
Thank you, sir.
Okay.
Good morning, everyone. I am Lori Gibbs. I'm the Deputy Director of Adult Programs for Sedgwick County Department of Corrections, and I'm so pleased to have been asked to be here this morning to share a very exciting program that we've been working on over the course of the last 12 months. This program is called Next Step Unlocked. A little over a year ago, I was asked to provide a tour of the Adult Residential and Work Release program to some folks from Goodwill Industries. And this is a tour, much like many tours that I give throughout the year to different agencies in the community. And I talk about client programming, I talk about success rates, barriers for our clients, and that kind of thing. When the tour was over, Emily Compton, then CEO and president of Goodwill Industries, asked me a question I had never been asked before. She said, if you had 3 wishes for your program, what would they be? And that was real easy for me to answer. I said, vocational training opportunities for our offenders. So many times, our clients really obviously struggle to make ends meet working for minimum wage jobs. And so for them to have opportunities where they can develop some kind of a trade and a career has always been something that I had hoped we would be able to do with our population. After the tour, Emily and her group went on their way, and I thought, I probably wouldn't hear anything again. A couple of weeks later, though, Emily called and she said, I'm intrigued by something that you said, and I think we might be able to partner with you in this venture. Would you like to meet? And I said, absolutely. So she assembled a group of stakeholders from Parole and WSU Tech and Goodwill Industries, and we had a meeting, and that's really where Next Step Unlocked was born. This is a partnership, like I said, between Goodwill Industries, WSU Tech, Workforce Alliance, Sedgwick County Department of Corrections, Kansas Department of Corrections, which is our state parole, to provide educational and vocational opportunities for offenders in our population, offender populations in Sedgwick County. In January of last year, we began defining the program. Goodwill, having never worked with an offender population in this capacity, relied heavily on our input in defining the program that would work for our offenders, not the other way around. And I think that was key. They were willing to hear from us what would be the best model that would result in the highest likelihood that clients would be successful in their programs. They were very receptive to our feedback. There's three key components to this program. There's an educational component, which allows for individuals to work on their high school equivalency while simultaneously working on a vocational pathway. We defined that our first pathway would be a welding program. And the other component of this is a life skills component. So they have an individual who works with them every week on some very core life skills competencies, financial management, time management, personal responsibility, that kind of thing. We recruited very strategically for our first cohort. Probation officers, parole officers were very instrumental in identifying people who were ready for this type of program in terms of their probation as a whole. Kate said I needed to be prepared to talk about funding and how this program is paid for. I borrowed this slide from Goodwill Industries. They follow what's called a braided funding model, so there are a lot of different entities who are contributing to this program as a whole, and that's going to be Goodwill Industries, through retail sales, and also through different grant opportunities. WSU Tech is considered the accredited educational institution of record. There's also a K-Board grant match through some legislation called Senate Bill 199. And then, of course, Workforce Center provides support as well in terms of those pathways. So there were 10 clients who entered the welding program in August of 2020, and I'm very happy to report that 5 successfully completed in December. And while this may not seem like a large number of individuals for an offender population who have a broad spectrum of barriers, this was huge. 3 of the participants who completed their welding certificate have an internship, an earn and learn with a custom body shop here in town. 1 participant recently had artwork selected for the Trio EOC art contest. All of the participants earned their OSHA 10 certificates in the course of this program, and they are all, 4 of them are in the process of completing their high school equivalency. 1 is going on to an associate's degree and received a private donation from someone in our community to pay for their tuition, and that is really significant for these folks. Just getting them to the starting line was a challenge. Being there to see them at the finish line was really overwhelming and inspirational. This is a picture of the toolkit, their welding toolkit that they received when they started the program. This was something that was very important to them, and they really took a lot of pride in this equipment and taking care of it and making sure that they had it with them every day. I want to play a video for you, short video, that Next Step designed, just so that you can hear from some of the participants yourself. I think it's muted. Oh no, how did that happen?
Opportunities to people with disabilities.
I'll just pull it back.
Goodwill Industries of Kansas is more than a thrift store. Our primary aim is to provide opportunities to people with disabilities and barriers to employment seeking independent and productive lives. We work to fulfill that mission through a number of services, including Next Step Unlocked, a program of Next Step Alliance in partnership with WSU Tech. Next Step Unlocked helps Kansans on probation or parole successfully maintain their freedom by providing them with the opportunity to study a technical career and earn their high school diploma.
This is a brand new program we developed from scratch. There's nothing like this in Kansas.
It means so much to the community. It means so much to the students who are involved. Every, individual we can reach, it means so much to us.
If we don't educate people and get them jobs that they can live on, we're not really doing much to change their lives. I mean, they can go to a program and get drug and alcohol treatment, but really everybody needs a job, and education is the key. So for me, this is a dream come true.
Oh, there's so many things that have been really wonderful. Overall, it's just been seeing the change in all of our participants.
The empowerment that I have seen in them and the change in who they are is just incredible.
The biggest lesson that I learned is that I can do this. I've always had self-doubt, but now that I'm here, I know I can do it.
It gave, I think, a lot of us a more positive outlook on our lives.
It opened a whole new horizon. I didn't plan on going back to school. I didn't plan on going to college. But this is helping me balance my time better, keep myself out of trouble, keep myself going on the right track. I'm proud of myself.
I got into this program and it's already starting to change dramatically. I've already got me a welder's job.
I'm OSHA certified now. I also have a part-time job at JR Customs.
I've got an education, something that I can be proud of besides my children.
Welding and going to school and everything will help me find a stable job, help me develop a career, not just a job, something I can see myself staying at for a while, for a long time, hopefully for life.
I have kids that look up to me, and I want to show them that if I can accomplish it, they can accomplish it.
With guidance and support, they will move into an in-demand career to gain a life-sustaining wage and achieve their goals.
It helps them with getting not only the GED and a job, but they can get a trade working at a salary that will help them with a sustainable income and help them become a part of our community in a responsible way. So it has ramifications that are widespread.
The Next Step staff is excellent. They help with rides, tutoring, they help with encouragement.
If I ever fall behind, they're behind me to push me forward, so it's not a lot of people that care like that.
They take a lot of one-on-one time. Take Judy, for instance. She constantly worries about all of us, and she texts us every day asking about tests and how we did in class. And the instructors in the welding class, Brian did one-on-one with me and helped me get caught up with the rest of the class, and they're just phenomenal. Like, they really have your back.
Judy's mom, she stays on top of everything. She's always texting, calling, making sure we're going to be on time. If we have any issues in the ride situation issues, she's there for us. Miss Lauren, she's been extremely helpful throughout the whole process.
Overall, we wouldn't be able to accomplish our goals without them.
Learn more about Next Step Unlocked and how your purchases help fund other Goodwill programs at goodwillks.org. Goodwill, more than a thrift store.
I will say I was so inspired by the bond that developed between these participants and how they held each other accountable for showing up on time, and encouraged each other to get their assignments done, and really helped, ensure that as a group as many of them as possible could make it to the end. It was really something to see. Very cool. About halfway through the program, all of our participants learned that they were considered Metallica scholars. And Metallica scholars, Metallica, the band, sponsors a program that provides opportunity for those who might otherwise be underserved in educational programs and vocational training programs as well. All of our participants were invited to kind of a press event where they got press passes, and Metallica wasn't there, but they found out that they were being fitted for custom Wolverine boots that are boots that they need to wear in their welding program, and they also received $500 scholarships to help cover some living expenses. One of the challenges of this particular program for our folks is the fact that it's a full-time program. And so it's very difficult for them to maintain outside employment while they're completing this educational and vocational program. So that $500 scholarship meant a lot to some of these folks in terms of helping them make ends meet. This is a picture on graduation day. You can see there were lots of smiling faces. Everybody was extremely happy and proud on this day. One individual was on quarantine, so you can see her in the background on video, but she was able to participate, and everybody was very proud and excited of these folks. What's next for Next Step? We just started our second cohort this month, 2 weeks ago. We have 11 individuals from Community Corrections who are part of this cohort in this welding program. We've worked real hard to develop a mentoring program to pair these folks with mentors. We've got a partnership with Pathway Church, who has been able to solicit a lot of volunteers who are willing to fill this role for our folks. So we'll be pairing individuals from our current cohort with a mentor, just someone who other than their probation officer who can kind of be a cheerleader and help them, problem solve some of the issues that come up. The Next Step team has been asked to provide guidance kind of across the state on this model. And so we hope to be able to share this with other jurisdictions in the state. And we were also able to get permission to move forward with a culinary pathway that will start later this fall, because not everybody wants to be a welder. So we're looking forward to expanding these pathways as time progresses and having different types of pathways available to students along the way. So thank you for letting me come and share this program. It's something that's been super exciting for all of us to see transpire, and very proud of the folks who've been involved to make it happen. So if you have any questions, I'd be happy to try to answer them.
Thank you, Lori. Great presentation. Probably have a couple questions or comments. Commissioner Cruz.
Thank you, Chairman. You mentioned other pathway programs. Do you have any idea of what others might be in the pipeline?
Yep, we're looking at carpentry as one. We're looking at Obviously, aeronautics in some way. I think that is one pathway that we've put on hold with there being some uncertainty in that particular environment. We wanted to start with, the welding program because it's quite a high demand field. So carpentry, the aeronautics, there's some look at some robotics potentially that might come into play. Also some computer programming types of things like that. So there's just a variety of things that we might be able to look at in the future. We have to be real careful working with an offender population. There aren't as many pathways that are open to our populations as the general public. So we've tried to focus on the ones that we know where there are employers in the community who will hire our folks once they complete their program.
Yeah. So switching gears just a little bit, have you been to the Phoenix yet?
Yeah, I haven't been, but our clients are going.
Yeah, good.
Yeah,
Okay,
yes.
That's great to hear.
Yes.
The Phoenix is a sobriety, 24 hours. If you're sober, you get to go and work out for free.
Yep.
And it's a sober living gym
Yes.
that we had discussed the last time we talked. So I'm glad to
Yes.
hear that you are making progress with
In
that.
fact, we, in the life skills component of this particular program, we are introducing Phoenix Gym to participants in this next cohort.
Great. I know that Dana will like that.
Yes.
Well, I appreciate this. This is really inspiring. I'm so happy to see the testimonials that you've presented. I hope that will inspire others to get involved. So thanks for all your work.
Sure.
Thank you, Glenda.
Commissioner Lopez.
Okay, sorry, still getting used to all this. Well, this is amazing. I love to hear what you guys are working on. I kind of want to just piggyback on something Commissioner Cruz said. But if there's a program that they want to get involved, how do they reach out, or who do they reach out to start that process?
Well, we're promoting it internally, so all of our ISOs are, have this information available. We're actually playing this video when our offenders were actually reporting to the office. We're playing this video on a loop in our lobbies so that sparks some interest and they can start, asking questions. We've got posters up at our residential facility, our work release facility. All of our officers have toured WSU Tech, and so they're familiar with what is available to their clients. If people are interested and they're not on supervision, although Next Step Unlocked is especially for offenders, Next Step Alliance is a program through Goodwill Industries that's open to anyone. So I would encourage them to reach out to Goodwill Industries to get more information about that.
And then how are you choosing who gets to be a part of this? If you have so many people that apply that want to, join this, how do you choose?
Well, the legislation has some criteria, and that is they have to be 21 or over. Internally, we've asked that they have a certain amount of time left on their probation, 6 to 9 months left on their probation. We've also evaluated, internally at least, risk level and where individuals are in terms of readiness. As you know, in our populations, a lot of individuals struggle with substance abuse. We want there to be some stability in those particular areas of their life before they take on something like this. This is a very rigorous program, and we want folks to be ready for the opportunity.
And how long does how long is that class?
It's a 5-month program. Wow. And 5 months seems like an eternity for a lot of our folks who are more accustomed to things happening, in a snap. And so that's part of the readiness and the recruitment process was identifying people, like I said, who are sort of primed for the opportunity, because 5 months is a very, very long time.
Well, I'm really excited to hear about all of this, and I can't wait to see, how this can really cut down on reoffending and all of that. So thank you so much. This is fantastic.
Thank you.
Okay. I would comment that I kind of feel like I'm witnessing a board meeting at WSU Tech with everything that you're talking about. Having welding as a lead, that's I'm on the board there at WSU Tech, and it's they do a fantastic job. The relationship with Metallica has been incredible, as you witnessed. The boots, the
Yes.
scholarship. the video was outstanding. Who did the video?
Next Step Alliance did the video.
They did?
Yes.
That's good.
Yeah.
Very nice.
It's very nice.
Very nice. And then, Glenda, thanks for being here too. I recognize that you're here. And you're right. And I'm so glad to see the life skills component because I think in this day of trying to get a value to your life, some of them we noticed as well at WSU Tech that they needed some life skills just about checking accounts and automatic deposits and things like that. So
Yes,
that's something that we kind of just stumbled into out of, they get a job and then they don't know how to cash their check on their first payroll check. So I'm really glad to see those components and your comment about the finish line and the emotion that happens not only for the individual but all the teachers and the support people. It's a highly emotional success story when they get their certificate. And so thank you very much for the presentation. Okay. I don't see other comments. Thank you again, Lori. Good luck with everything. Okay.
Okay, now we'll bring Tim to the podium and we'll have our weekly discussion on vaccines. And I think Tim will kind of talk about where we're at today, where he sees us in a week or two, and then maybe some long-term discussion, best we can forecast with what's going on with vaccines.
Okay, thank you. Tim, welcome.
Thank you. Good morning, Commissioners. This morning I was on a phone call and we spent a lot of time talking about the knowable and the unknowable, or knowns and unknowns, and I'm going to talk about the knowns, and I know you're more interested in the unknowns, and hopefully over time we'll get all of those gaps filled in. But as of Friday, the 16th, Health Department had administered 9,460 doses of COVID-19 vaccine to healthcare associated workers during phase 1 of the Kansas vaccination plan. And as of 1/13, which is last Wednesday, Sedgwick County providers who voluntarily report to the Sedgwick County website that they had administered 12,687 doses. And so on our website, we've got a location for other entities to report the vaccinations that they're dispensing. And so we know that we've got at least one hospital that's doing that right now. And over time, as more vaccinators become identified and participate, we hope that they'll also voluntarily report so that we're able to help share with the community how much vaccine has been distributed. This week, last week, we received 1,400 doses for second doses for the healthcare associated workers. One of our partners also received, GraceMed received the 8,500 that they received. So, and they said that they're going to work with us to dispense those again. So we'll have adequate second dose vaccinations for all of the folks that we vaccinated with the first dose in phase 1. Now, the Moderna vaccine requires a second dose be given 28 days after the first dose. There's a window 4 days before and 4 days after, but ideally it's given as close to that 28th day as possible. And so we're going to begin scheduling 2 days prior and up to 4 days after. So again, we received the vaccine last week, but we didn't have anybody that was 28 days out last week, so we didn't vaccinate anybody with that last week. We'll start dispensing that this week. And so the first doses will go to EMS and health department staff that were vaccinated on 12/23. That was when we got that first shipment of vaccination. The remaining 440 doses in the initial phase 1 allotment will go to some specific healthcare facilities and their healthcare associated workers, and a few long-term care facility residents that aren't associated with a pharmacy. And those vaccinations will be done at their facilities. So we've got teams that are going to go in and do the vaccination in those facilities. We will do the second dose vaccinations this week at the health department. So there won't be, again, I had mentioned, not going to be a lot of activity at Interest Bank Arena this week because of the timing of doses when they came in and having to wait that 28 days before we can start with that second dose. The portal for healthcare associated workers is now open to schedule that second dose and can be found on the Sedgwick County webpage. It'll be the same process that those healthcare associated workers went through for their first dose. And this week we'll also continue to do no-cost walk-in PCR testing for residents regardless of symptoms today through Friday. We're open from 8:30 to 11:30 and then 12:30 to 4 at the Extension Center, 7701 West 21st Street. No appointment is necessary. So we continue to test as well as vaccinate. And then our disease investigators are continuing to do case investigations for positive cases. This week, we have been notified that KDHE should receive, that we should receive a shipment of vaccine for phase 2 from KDHE by Friday of this week. Could come in Thursday. We receive about a 24-hour notice for delivery. Health Department is prepared to receive either Moderna or Pfizer vaccine. And as you recall, the previous shipments that we've received were Moderna vaccine, but we may receive Pfizer. We're prepared for either one. And we expect that this shipment that we receive this week will be for phase 2. We're planning in anticipation of the governor announcing that people are ready to move into phase 2. We don't have the vaccine yet, but we expect that we will get a small shipment later this week. If we do, we're going to administer that vaccine to folks that are in phase 1, so they're healthcare associated workers that didn't receive a vaccination during phase 1 for whatever reason. Some chose to wait, some have changed their mind about whether or not they were going to get vaccinated. And then we will begin our phase 2 vaccinations focused on Sedgwick County residents aged 90 and older. Again, phase 2, both CDC and KDHE have talked about 65 and older as being the primary target for that phase 2 group. But the numbers of vaccine that we receive will be so small compared to that large age population. Dr. Minz has recommended again that we focus on people that are most likely to be negatively impacted by coronavirus and the folks that are most likely to die from coronavirus. And so we're going to start vaccinating at the upper end of that age range. We will begin to schedule appointments as soon as we're confident that that vaccine is going to be here. We will do vaccination initially at Interest Bank Arena, and we will also begin to do mobile sites around Sedgwick County once we receive additional vaccine. To receive the vaccine, those residents that are over age 90 or 90 plus, they have to have an appointment, and at that appointment they'll need to bring some kind of identification that indicates their age, so we need proof of age. And then there's a vaccine consent form. As with everybody else, there's a vaccine consent form that they can fill out, or a caretaker or family member could fill out on their behalf in advance and have them bring it with us, or they can fill it out at the vaccination clinic. So we'll continue to do vaccinations as we have at Interest Bank Arena, but for a very narrow age range in the community. Residents that are younger than 90 years old won't be able to make an appointment. At this point in time, they should watch local media and sedgwickcounty.org website for when appointment times will be available to their age group. And so we're just going to walk from over 90 all the way down until we get to 65 plus. And so that's our recommendation for Dr. Minz, and it's all going to be dependent on vaccine availability. Phase 2 includes people that are age 65 plus, but because we will receive such a limited amount of vaccine initially, and there are about 111,000 Sedgwick County residents age 65 plus, we're prioritizing those 90 and older initially. We're notified 12 to 24 hours before we receive vaccine. Because of the unpredictable nature of vaccine distribution to Sedgwick County Health Department, We're not scheduling ahead of vaccine receipt. Our intent is not to schedule more appointments than the vaccine we have on hand, and additional appointments will become available as we receive more vaccine. If doses are received this week, and we'll also be able to schedule individuals that were in phase 1 as part of that phase 2 group, and they can use the same process that other healthcare workers have. So again, we don't have the portal open yet for phase 2 because we're still waiting on that confirmation email that says the vaccine has been shipped. We believe that we will receive a shipment this week, but we're not going to schedule anyone until we know that we're actually going to be able to serve them. So I'd be happy to answer any questions if you have any.
Commissioner Cruz?
Tim, you know we have questions. Thank you for that update. A couple of things. So the second dose of the first round, all of those vaccines have been received?
Yes.
Okay. So we are starting with EMS and healthcare departments and then working our way down. Okay, so the first round is covered.
Correct.
So the second round, you talked about the 111,000 people that are 65 and above. Does that include long-term care facilities?
It does.
Okay. So the question would be, if long-term care facilities are receiving vaccines from Walgreens and CVS, who is receiving their vaccines from the federal government, how do we know which numbers will be accurate for us to manage outside of long-term care facilities?
Well, right now we have to do some estimating because we know that about 2 to 3% of the general population is in a long-term care facility. And that percentage, of course, is higher for folks that are age 65 and older. But those folks will be taken care of. So we know that the universe that we're going to serve is less than that 111,000, maybe 111, maybe 100,000. I know that we've got the data somewhere. I don't have it with me, how many people are in long-term care facilities right now. But again, you're right. Walgreens and CVS are going to take care of the folks that are in long-term care facilities. We're going to serve the ambulatory population, 65 and over.
Okay. So the talk of ages is one thing, but what about comorbidities for those who suffer other health conditions but don't meet the age requirement? How will they fall in line?
Right now, they are in the phase 3. If you look at the most recently released governor's plan, those folks would be in phase 3. We believe that additional flexibility has been granted to allow local health departments to manage through the phases. And Dr. Minz's recommendation is that we would incorporate the population younger than 65 but with comorbidities into phase 2. But they will be at a later point in time than the folks over age 65.
Okay. So going back to seniors, those who don't have access to computers or don't communicate in that way, how are we accommodating those folks who may need a phone call, who may need to schedule via phone?
That's an excellent question. And we will have, when we are prepared to take appointments for phase 2, we will have not only the website live, we'll have a phone number that people will be able to call. We're going to encourage people to utilize the website because that's the most efficient way for us to handle those sorts of things. But we will have a phone number available. And so when we announce that we're ready to schedule phase 2 vaccinations, we'll include the information about the website and a phone number that people can call.
Okay. One last question. So you talked about, at the very beginning of your report, you said specific healthcare facilities that we are
There are a couple of hospitals in Sedgwick County. There are many hospitals. We think of the two big ones, Wesley and the Ascension Via Christi hospitals, but there are other smaller hospitals within Sedgwick County that did not receive direct shipment of vaccinations, and so their healthcare workers were kind of anticipating that their hospitals would receive vaccinations, and they didn't. So we're going to go into those facilities. They're much smaller hospitals, but we'll go into those facilities and get those folks vaccinated yet this week, and that will be their first dose of phase 1.
Okay, so we're partnering with those facilities. How are we partnering with Guadalupe Clinic?
That's an interesting question that I don't have an answer for. Guadalupe Clinic staff would have certainly been able to go through the mass vaccination clinic like we had for healthcare workers, associated healthcare workers. And if they haven't yet, they would be part of that population that I talked about in phase 2. They will be eligible to register to get vaccinated along with those folks 90 plus.
Yeah, they were kind of left off the list for, I mean, are they not an FQHC? They're not, are they?
No, they're not.
So they were kind of left off. They didn't receive any vaccines. So what I'm concerned about is the population that they serve having access to vaccines when transportation is an issue and all sorts of things are issues. So I wonder how we can partner with that clinic to be able to vaccinate their population at their clinic instead of having to send them to our clinic or some other clinic.
Well, I would hope that they'd have an opportunity to call somebody at the health department. My recommendation to them would be to contact KDHE first, to go through the process to become designated as a vaccinating clinic, a clinic that's going to do dispensing of vaccination. Because if they're not registered with the county, and again, this is a nebulous piece of information. We don't know who all has been registered, but if Guadalupe has not, then we wouldn't be able to transfer vaccine to them. We would have to go on site and do vaccinations for them or work with them to get their patients to us. Or it could become a location for one of those mobile outreach clinics that we'll also be offering.
Okay. And then lastly, Representative Elizabeth Bishop and I have been communicating over the weekend. She sent me a list of questions that she plans to ask at the Joint Health and Welfare Committee today at noon. I'm only going to be able to be on it for an hour. I wonder who will be able to watch the entirety of that to ensure that we get all those questions answered. I mean, obviously, I don't know if we're going to be able to answer any questions or ask any questions, but I believe that a lot of the questions we have will be asked in that meeting today, and I want to ensure that someone's going to be there the entire time.
Yeah, I'm fairly confident that someone from Watkins and Associates will be engaged, and I think maybe somebody from here in our legislative agenda group may be able to do that as well.
Okay.
But I agree, there's lots of questions out there that we would like answers to as well. And
Too many. Yeah. Okay, thank you so much.
Thank you. Commissioner Lopez?
Thank you. I think most of my questions were just answered, so that's good. But I do have a couple more. If we do give these vaccinations to clinics, are they going to have to follow our guidelines for phases, or would that, I guess, what would be the requirements of them?
That would be our expectation. I mean, we're trying to vaccinate the entire community in the same fashion. There are a couple of different streams for vaccines to enter the community, and some of them have different sets of criteria, but that would be our hope.
Okay. And do we know how many vaccines we're getting this week?
It has not been confirmed yet.
Okay. And then I think you touched on this, but I just want to make sure I know we are doing mobile testing, we'll be doing mobile outreach as well for the vaccination.
Yes.
I think that was it. Thank you.
Okay. Commissioner Howell?
Thank you, Mr. Chairman, and thank you for the update. I do have a couple questions. So we talk about comorbidities. That's referenced in here as in here it calls them a severe medical risk. I guess I would differentiate between comorbidities is a very broad term to mean a lot of things. When I talked to Dr. Mins last week, he talked about a little bit about people with the most fragile health situations, that they would be able to talk to their doctor potentially and get a prescription. They would move them up this priority list. Is that something we're still contemplating potentially?
Yes, it is.
Because here's the thing, we don't know when we're going to get the vaccine in, but people who think they may be qualified to get into that category, they may want to go ahead and talk to their doctor now and get that prescription ready to go, so that when the vaccine comes in, they'll be ready to essentially schedule that appointment. And when I say comorbidities, in my mind, someone who's managing diabetes, for example, isn't the same, or someone who's just obese, for example, is not the same as someone who's dealing with stage 4 cancer, has immune system that's been destroyed, for example. So I think that, trusting our family physicians across this community to help us, if you will, filter that population, if they feel like someone is extremely fragile in their health, they ought to be able to get that support from their doctor, I would think. And so something we can maybe put out now is that we would hopefully ask them to prepare, if you will, now, so that when that vaccine does become available, that we have the way to know who would be the right people to get that vaccine. Because I think we're always going to have more people who want to get the vaccine than we have vaccine in our possession. So I do agree that this age range may be pretty smart, but I guess I'd like to at least look at the folks that may be in that category as being something we would consider that now, I guess. I'm not sure who can make that decision.
What I can tell you is that Dr. Mins is having conversations with other healthcare providers in the medical society to try and determine what's the most efficient way for that to occur. We don't know yet how many of the family physicians, primary care doctors, for example, use the health information exchange. There may be an opportunity for us to work with healthcare providers to mine their data and then provide that information to us through the information exchange. We don't have all those details worked out yet. It may not require a physical script. It may be a transfer that can happen without an additional trip to the doctor's office. We don't have those details worked out yet.
And I agree. If the doctor knows their patient's medical situation, they should be able to provide that without actually visiting the physician. I would think that.
I think that's what Dr. Mins specifically said last week. I don't know that we want to burden patients with having to go into their physician's office just to get the script. I think the doctors are going to try to work that out on their behalf. That's what he had said last week.
And especially in light of a pandemic, that's certainly a lot smarter. But I do think that they ought to understand, though, that maybe something needs to happen. They may need to contact their doctor's office, maybe have a conversation and initiate this effort, because otherwise, when the vaccine shows up, I don't think they'll be ready necessarily if they don't do that. Start doing that now, I guess is my point. So that needs to be fleshed out the rest of the way and communicated out to the public. I do agree. Most of the questions I think I have been answered. The one question I would get, I guess, is how do we know which long-term care facilities are getting services through CVS and Walgreens versus which ones are not? How do we know which ones are left out?
You entered into that area of the unknowns again. We're trying to get information from KDHE if they have it available to them so that they can identify all of the long-term care facilities. We don't have that information. Some facilities have self-identified and said we're in that circumstance, and so we're trying to serve them right now. We don't have all the data that we need to do this work.
Yeah, the unknowns is pretty frustrating. But I think we should communicate to all the LTC facilities in this community and just let them know if they're not receiving vaccine through CVS and Walgreens, they need to let us know that so we can advocate for them and try to help, broker a solution to that problem. We're not going to get the data from the state or the feds, it sounds like, necessarily, but I do think that LTC facilities are, they would be aware if that was the situation at their facility, they would know that, and they should be able to communicate that to us. So, and then of course the one you probably really can't answer that everybody keeps asking is, the the coordination that's happening at the high levels of government right now. It seems like we just get stuff when we get it. We don't have any advance notice as to what's coming and when it's going to come. Just registering, I guess, my frustration. That seems to be a reality. And so I guess my question is this. I know that you're advocating strongly for recognition and our fair share. Those are the words we would use. And I'm sure that manager, you're doing the same, and our health department's doing the same. What can we as commissioners do to help join in that fight? What are we able to do, if anything, to help, I guess, argue for better information or for more vaccine to Sedgwick County?
I'll take a shot, and Tim can chime in. I think, Commissioner, at this point, of the three unanswered questions, which are burning in everybody's mind, is how is CDC rolling them to the states? To me, that's Senator Moran and Congressman Estes type of communication from electeds. The second question is KDHE to the counties. I think Commissioner Cruz with Representative Bishop is the track we should take, where we reach out to our local contingency of state elected officials and ask for clarity and continue to pound on that. I know Adrian and Tim at a staff level, we have been asking for weeks to answer that question. We haven't got an answer yet. I know we've had private sector reach out to KDHE and haven't got the answer. So I think our local state representation, as we have the meeting today at noon, that's the kind of thing that will help us get answers. And then the third thing is in our wheelhouse too, which is we need to know, we as a county need to know who are our local partners who will be given vaccination access. And to me, because we need to now be coordinating with them and getting logistics set with them so that when we do get vaccines over the next few weeks and months, we can manage this efficiently, but we can't do that without the contact list. So those are anything you can do at representative level with the state to get those final two questions answered. And if you get a shot with the senator or the congressman, that I think is what we need from the commission.
Do we even know whether these pharmacies received Moderna versus Pfizer? Do we know that?
We had interns just call last week to determine if Walgreens or CVS was administering vaccine. And just a phone call. CVS had not. The other Walgreens was administering but I can't tell you. We don't know which vaccine now. Yeah. So we know that one of them is out doing long-term care facility inoculations. CVS is not yet. They are in Emporia, but not in Wichita yet. And that could have changed over the weekend. But we're just trying to get those answers so at least we can comprehensively report to the people what we're vaccinating. But we could use help politically with that as well.
I might be able to answer this question myself, but I guess I'd just like to confirm. This is happening across the entire nation. This is not just a Kansas thing or a Sedgwick County thing. This is a nationwide situation where the federal government has done this to every state equally, I assume.
It is nationwide, and you have 50 states with 50 different kinds of programs. I'll mention just over the weekend, I have associates in Oklahoma. Oklahoma was being accoladed a couple weeks ago that they were rolling 65 plus for vaccines, and now they have found themselves in a position where they don't have second vaccines for those people. So nobody really has this down to a science yet, but that doesn't mean we shouldn't be working, at least in the state of Kansas, for our people to do the best we can.
Well, the reason I ask that is, or I guess make that point, is I understand that there are counties in Kansas that don't even have a Walgreens or CVS, and so they've got to go to an adjacent county a long distance to even get that vaccine to the right people, and I'm not sure who's traveling to who. Okay, so it's logistically difficult that they've done it this way. You would think they would find someone in the community that can manage that if there's not a provider that's already able to do that. So Sedgwick County is a big county, and we have 20 cities. I guess my question would be, we have LTCs, I think, in all kinds of places across this county. It might be nice to know that logistically, I guess I assume that CVS or Walgreens, when that time comes, they're traveling to the LTC facility, not the other way around.
I believe that's correct.
So
correct. Yeah, those pharmacies are doing on-site vaccinations, and I will tell you that we do communicate with our long-term care facilities in the health department has regularly scheduled calls to go over issues. And so I'm sure that we've talked to them about whether or not they're signed up as a participant in that program or not. But we do reach out to all of those facilities routinely.
All right, well, thank you for the briefing. I appreciate all your good work on this.
Commissioner Lopez?
Thank you, Chairman. Sorry, Tim, I had a couple more that I forgot to ask. I talked to the Guadalupe Clinic as well, and one thing that I thought of was reporting to KDHE after they vaccinate people. Is that just, can they send like an Excel spreadsheet, or do they have to have a more detailed information to send to them?
The information that I learned late last week was that there are 87 fields in the vaccination reporting process. 20 of them are mandatory, but there are 87 fields. I cannot tell you at what level of a provider you have to be able to do data upload versus direct entry. I don't know that.
Okay, so if they do, when they call KDHE to see if they can actually give the vaccine, I'm assuming that they'll give them that information at that time? Okay.
Do we not know if Guadalupe has done that already in your contacts with them?
From what I heard, they said they were trying to get it, but they didn't say if they actually contacted KDHE or not. So when I talk to them, I'll mention that. And then last, I just have one more question. Since we're starting at 90 above, when we finish with that demographic, will we step down incrementally to 65, or will we just open it up to 65?
My guess, based on what appear to be the volumes of vaccines that we're going to receive, we're going to have to do it incrementally, and it may be in 1 year or 5 year or 6 month increments. It's really going to depend on how much vaccine we're scheduled to receive.
Okay, thank you.
Commissioner Cruz?
Thank you. So going back to the long-term care facilities, they're not all created equal. I mean, they have, a skilled nursing facility is different than an assisted living, is different than an independent living. So are those even tiered, if you will? I mean, are they responsible? Because most of them have their pharmacy will deliver the meds to the location. Do we know if they're going in to provide vaccines? And then are they even having, I hate to use the word pecking order, but is there an order in which they're...
You, again, have drifted into the area of the unknowns. Since we're not getting information from KDHE or CDC about that long-term care facility program directly, we don't know all of the answers that you're asking, but by and large, it's the skilled nursing level long-term care facilities that participate in those programs. And there are, as you mentioned, many other levels of care that are sometimes referred to as adult care homes. Mm-hmm. And so we're working with some of those other entities. Some of them contacted pharmacies and made that arrangement, and others did not. And so those are the ones that we're working with right now.
Okay, so excuse me if I've missed this. Once we do receive those vaccines, Chairman mentioned, we as a health department have been preparing multiple years for pandemics, right? And usually the vaccines, like in those preparations, and please forgive me if I'm misspeaking, come to us, we disseminate them out. So right now, how it came down is the vaccines came to hospital systems, they vaccinated their folks. It went to FQHCs, they vaccinated their folks, gave the remainder to us. So will this next round, and this is probably a question for KDHE, will they come to us and we will disseminate them to physicians' offices? How are we going to be partnering, and what's our plan to partner once we do receive those vaccines? Or are we just going to take it all and we're going to vaccinate the whole community at Interest Bank?
It's all going to depend on the volume in which it comes to us, and at what point in time the volume from the manufacturer is sufficient to not only supply the health department and the few partners that we have, but also those other vaccine dispensers that signed up earlier. And those organizations are going to have to make decisions on their own as well about how they want to handle it. If they want to, if you're a large family practice clinic, you would have to make a decision whether or not you want to receive that vaccine, manage the vaccine, and vaccinate all of your patients or some subset of your patients, that sort of. So those are decisions that those entities are going to make as well. We're trying to talk to them to figure out what their plan is, but right now, all of the planning that we're doing is contingent upon how many vaccines we receive in any given week and what kind of throughput we have at Intrust Bank Arena or wherever we have our mass vaccination clinic. And until we get, there's so much vaccine coming into the community that we can't handle it, it makes sense for us generally to deliver that through a mass vaccination clinic rather than spread it out.
Okay. So other than the FQHCs and those federal, like the CVS that are getting it directly from the federal government, how can we ensure who the federal government is sending them to? I know that's another question, but I want to make sure that it's asked. So are there other partners that is getting a direct allocation from the federal government and not from the state? So the Fed's giving them to state, Fed's giving them to here. How do we know? How do we know the total number of vaccines in our community to know? When we're talking about 111,000 seniors, we take out the long-term care facilities. What are the real numbers that we're talking about? How long is this really going to take? I guess that's really the questions that I've been receiving.
Well, and some of the calculations that we've done would indicate that we're, again, depending on availability of vaccine, if enough vaccine comes to us that we can fill every slot that we can schedule, we're talking about a 4 to 6 week at best, maybe 6 to 8 week process to get through that phase 2 group. When the governor announced her plans a couple of weeks ago, she talked about a 2.5 to 3 month phase 2 time period. So for folks that, one of the things that the commission can do is help the community understand that patience is going to help them, because this is one of those things that it's going to take much longer. And you had asked an earlier question about practice for mass events and that sort of thing, and you're absolutely right. Most of the practice that was done tied back to anthrax threats and things like that. So the thought was there's going to be 500,000 doses that come into the health department, and then we're going to spread it out across the community, and that's going to happen within a 3 or 4 day time period. And so those are the kind of plans that we've developed and are sitting on a shelf, and we don't get to use them this time because that's not the way that the medication comes in.
Yep.
It's just dribbling into the community slowly, and so we've had to modify our approach quite a bit.
Two different vaccines, 2 different shots during 2 different time periods too. So this is not what we had. We were thinking single. Someday when we get the Johnson & Johnson vaccine, where it's a 1 shot, you're done, things will be much better. But right now we're juggling 2 separate, we will be soon, juggling 2 separate vaccines. One has a 21-day period, one has a 28-day period. It has to be sequenced. So it's, as Tim said, this is going to take some time and patience.
Well, it's a challenge, and I know that there are a lot of people in our community working on this, so I appreciate your work. Hopefully we'll get some answers today or this week. That's what we're going to hope for.
Okay, Tim, thanks for the presentation.
Sure.
Good luck. Have a good week. I'm sorry. Oh, David Dennis has a question?
He said he did not.
Oh,
no,
okay.
I don't have a question. I appreciate the update that you provided us today. The main thing that I worry about every single day is that we've got more and more people coming down with COVID, and we just don't have a vaccine. Thank you.
Okay. Thank you, Commissioner. All right. Thanks, Tim. Okay, next up.
Talk legislative agenda next, and I think Mike's going to lead it today.
Thank you, Tom. Mike, Capone County Councilor. I'll take the lead on this. I believe we also have Jason Watkins on the telephone here. I don't know if Jason can hear. Jason, you there? Jason, can you hear me? We'll try to, we'll figure out how Jason was on him.
I can hear you.
Okay. Hey, Jason. A few things that we need to discuss today. First of all, I was talking to Senator McGinn yesterday. We have 2 bills that she's already tried to introduce in her committee. We don't have bill numbers, I do not believe at this time. They've just been sent to the reviser and haven't been introduced in her committee yet, but she's hoping to run these two bills and take testimony on the bills a week from today. And I believe that would be the afternoon, next Tuesday afternoon. We need to decide, and one of the bills is the nuisance abatement bill that we have, and the other bill is the bill to change the statutes to allow a Sedgwick County specific charter commission. We need to decide who we want to testify for these two bills. In the past, Chris Labram has testified on the nuisance abatement bill, and he'll probably submit testimony and be available to testify as well. But I think last year the chairman, I think maybe Chairman Meissner testified in favor of this bill as well. And then again, at the same committee hearing, we're going to have the Charter Commission bill, which is a simpler bill, and we just need a commissioner probably to take the lead on that, and that's just basically changing the anomaly in the statutes to allow Sedgwick County to establish a charter commission if needed, similar to what Johnson County has, and that in fact Johnson County used to reshape their government up there in terms of the number of commissioners and how the other row offices were handled. But those are coming up probably a week from today, and the testimony, those two bills actually made it through the Senate last year in fairly overwhelming fashion, thanks to Jason. And the language that we have on these bills is the same as last year, so hopefully the testimony is going to be fairly simple and the same as what we presented last year, except for the change in the bill numbers. So I don't know if commissioners have any thoughts on how we want to proceed in handling those two bills.
Okay, Commissioner Cruz.
Thank you, Chairman. I would like to volunteer to provide testimony for the Charter Commission.
Okay, that's fine. And neither one of these are too complicated. I'd be glad to do the nuisance again, as long as Chris is in the bullpen, ready to answer questions.
I think, he would be able to get down into the weeds on any questions relating to the nuisances we have in Sedgwick County. We've already presented Mr. Watkins with some draft testimony, and we handed out last year to all of the legislators on that committee pretty graphic pictures of some of the nuisance issues we've had in Sedgwick County and why we need this legislation, and we've updated that, and we're providing that as well.
It's been a little more problematic in Commissioner Dennis's district and even a little bit Commissioner Howe. And
I think Commissioner Cruz has had some nuisance issues, and certainly Commissioner Lopez's district has.
I'm okay if any other commissioners, I know you can all articulate the problem pretty well. Out of respect for real life experiences, I'd be glad to defer to any other commissioner that might want to testify with Chris's backup. So, and we can maybe discuss offline if we need to. And Mike, if I can figure out if one of the other commissioners wants to delve in. My question is this going to be live attending in Topeka or Zoom? Or do we know?
They're using WebEx. Jason, do you want to suggest anything relating to how we want to present testimony next Tuesday?
I'll just comment in terms of how they're doing testimony. You have the option of testifying in person if you'd like to. The preference, I think, for most chairs and committees is that you do indeed testify via WebEx. And we would need to get the testimony from each individual turned in at least 24 hours before, and that would then result in you being sent the link so that you could appear via WebEx.
Okay. I think Commissioner Dennis might have a comment or question.
Mr. Chairman, I appreciate it. I believe that we need to have some kind of a formal testimony to support this. I don't know if it's better to do a written testimony and send it up or to join by WebEx, but I believe we need to be on the forefront of making sure that we can push this forward. So if that means that we have a joint letter that's signed out by the chairman saying that all the commissioners support it, or whether we each need to send a letter up. I'm not sure what the best thing is. I trust Jason to come up with that, but we've definitely got to get behind it. Thank you, Mr. Chairman.
Yep, thank you.
We can certainly.
Mr. Chairman, could I weigh in on?
Absolutely.
Just add something to Commissioner Dennis's comments there. One of the things that's very helpful in addition to testimony is, and Mike and Akeem can get you a list of the members of the committee, but as much as any of those members of the committee can be contacted, especially on nuisance abatement, there's not a lot of controversy surrounding Charter Commission. That's kind of a rats and cats cleanup type bill. Charter Commission, does bring out some opposition. So as much as committee members can be contacted by commissioners, that's also helpful in addition to good testimony, especially any of those on the committee that particular commissioners may have a relationship with. It's good for all of them to be contacted, but our commissioners carry a lot of weight when they have a conversation with somebody that they already have an association with that's in the legislature.
Okay, that's good to know.
Yes, and we'll get you a list of those committee members in the next day.
Okay, that'd be helpful.
And so if we do it by WebEx, again, and I'd be remiss, Justin Wagner from our office is also in here. He had actually drafted the bill for nuisance abatement and can answer any questions regarding that. So he'll be available to help any commissioner that's interested in testifying on behalf of that bill to navigate through some of the legal issues involved with nuisance abatement. And I believe what happens is, Senator McGinn said that they would send a link to us, her staff would send a link for WebEx to be able to testify for that bill. So we have those two bills a week from today, and then the other piece of legislative news that we wanted to talk about was the tax bill, and that bill went through the Senate very quickly. I think you've all been aware of what some of that process is, and Jason's reported on that. That's already passed through the Senate. It's going to the House. There's very little change to the original bill in the Senate. We provided testimony. Lindsay is here. We provided testimony from Lindsay on 5 different changes we would have liked to have seen in that bill, while being as supportive as we could of the legislation. And all of those changes were pretty much ignored. The number one change that needs to be done for this bill, more than anything else, is to delay it beyond this year. We really need time to adapt to what this bill is trying to do, and I'll let Lindsay jump in on just some of the details and headaches that this bill was going to cause the clerk and the county if it has to be enacted this year. But at least if the legislature would give us until the 2022 budget process to start complying with this, we could have time to perhaps overcome some of these obstacles. And I let Lindsay jump in at this time if you'd like.
I'm happy to review any of the suggested changes if you all have questions, or I'm available to answer questions.
Right. Okay. Why don't you just be available?
Okay.
But tell us the challenge mainly is just the timing, right?
Well, I can go over some of what Lindsay, we prepared testimony on behalf, Lindsay drafted much of it, but we prepared testimony for her at the last hearing. And the reason we did this, we really didn't have time to get before the county commissioner to approve an official letter coming from the chairman or from the board. But some of the comments that Lindsay pointed out last time was the effective date of this law should be changed to be effective January 1, 2022. And the clerk's office has mentioned that they're going to need some software changes in order just to determine the revenue neutral rate, and that it's going to affect all 105 counties. And just some of the software updates that are going to be needed are going to really put some of these county clerks, I think, in a real bind. We had mentioned that, well, I don't know. Lindsay, you want to go into specifics?
Sure. So I'll just pick up from where Mike is. There are 5 points listed on this testimony that all commissioners received copies of. And so, again, number one primary is getting this pushed out a year. This will have some significant implications to our budget calendar, also to the clerk system, so we definitely want to get that changed. So then the second item that we talked about was the notification letter to each property taxpayer. So one of the issues that this Senate bill includes is not just our own property tax rate, but it needs to be included for every property tax entity essentially that parcel is paying on. And so even though, for example, school districts are not subject to this, school district information will have to be included on each of these letters. And so we anticipate that letter itself would look like the first half property tax mailer that goes out, and that costs us roughly $150,000 in each of the last 2 years to get that out. So that cost is then pushed out to the taxing entities that are trying to increase their property tax rate, and that's due back to the county by December 31st. But one of the things that the clerk's office has noted is that there's not really a structure in this bill to do that. So one of the things that we had proposed, and I know that Commissioner Howell had referenced some specific changes on, was trying to inform folks in a different way. Maybe we send, the idea that was contemplated here was sending an idea on a link on a postcard. If you're familiar with our My Local Taxes application, you can type in your physical address, you can go in and you can see all of the tax rate information for all of the taxing entities, and then a little more detail about county. But that could be a viable option to make that same type of information available by parcel, and it would be cheaper than sending out this mailer. One of the benefits also, and we get into this a little bit later in the testimony, is that it gives us more flexibility with our calendar. Right now, everyone has a consolidated letter that goes out. So let's say that you live in the city of Wichita, and both your city of Wichita and your Sedgwick County property taxes are going to go up. We have to wait until both City of Wichita and Sedgwick County, and then maybe any other taxing entity that you're a part of, submits their information, and that goes out on a single mailer. That means our entire process then is tied to when that mailer goes out and when that triggers that 10 days. So if we are able to have our own unique way of reaching out, that can allow us to keep our more normal budget calendar that otherwise we wouldn't be able to do. So then item number 3 on the testimony has to do with the September 10th date. Right now, if we want to have a rate over and above the revenue neutral rate, then that means that we have to have a public hearing, and we have to give at least 10 days notice of that public hearing. When that public hearing occurs, the law calls for the commission to vote on that higher rate at the conclusion of the hearing. What that means is if somebody comes in with a point that sounds really great and really legitimate to you, staff doesn't necessarily have time to go and vet that and get information back to you to make a decision. So one of the things we would like to do is maybe break that apart and have the flexibility like we do under Truth in Taxation today, where the commission just has to vote to approve that resolution before the budget. But then you can have as much time between that vote and when you adopt the budget as you want. And so it gives time for that informed consideration. Item number 4 is kind of along a similar vein. So we have to have that hearing by September 10th. Then we are required to provide certified budgets to the clerk by September 20th. That's a 10-day window. And the only concern we have with that is if there are some significant changes that are made. I don't think I've ever shared with you the certified budget forms that we turn in, but there's about 50 tabs. Each fund has its own. There's all kinds of detailed information for 3 years worth of data. And so those things can get fairly tricky, and they all work together. Now, I will tell you the clerk's office is not super comfortable with adding in any extra time to that because that already puts them in kind of a time crunch to get everything done in order so that mill levies can be set and tax bills can go out. So that's a consideration. And then finally, a very pie in the sky concept. Historically, even under the property tax lid, even before the property tax lid, we were allowed to take certain things into account when we were calculating kind of that minimum levy we were allowed to have, or I'm sorry, the maximum levy we were allowed to have. That included if a property changed in use. We were allowed to take that into account. In theory, that property then requires different service. And so the tax rate takes that into account. If, for example, you're a city and you annex new property, that would be something that would have been allowed to have been taken into account, because now that your property's bigger, you should be able to have more money to service that property, right? Again, pie in the sky, we know that's kind of what the legislature's intent here is to make sure we're disclosing that information. They're not trying to limit you. But those were things that were pragmatic, realistic changes that seemed fair, and so we would like to see those added back in. Again, pretty pie in the sky. We don't expect the legislature to actually do that. So that is the testimony in sum, and if you have any questions, I'm happy to talk about those.
Commissioner Howell?
Thank you, Mr. Chairman, and thank you for the reminder of the testimony. I actually planned on testifying, submitting testimony and testifying on this bill, because I agree with much of what you just described. I don't agree with 100% of that, so I'd like to explain that to my colleagues, and maybe we can come together on this. But I think from pragmatically from the legislature's perspective, they want I would just say this: governing bodies across the state of Kansas have come out as opponents to this bill, and so if they are personally supportive of the bill, I think much of the testimony that's been given to them has been ignored, and I think that's understandable, because I guess I just say that the culture up there is, if someone is with you and you want a small change, I think you get more reception than if you're just simply opposed to any change. So let me remind us that these very same governing bodies have been strong advocates for the repeal of the tax lid that was passed in 2015?
15 and 2016.
By the way, which was very bipartisan, although it was passed in the middle of the night, and there's a lot of stories about that. It did have hearings, and at the end of the day, and when it was finally passed, it was a very bipartisan supported piece of legislation with a lot of problems. And then to remind us, in 2016, we leaned forward as a county, and we went up there to advocate for some logistical changes in that legislation, and most of the governing bodies of our state were advocating for a repeal of the tax lid when we were actually advocating for some fixes to the tax lid that actually made it more workable. So I think it was a better strategy. Let me talk about a better strategy for this bill. I would tell you, if anybody doesn't understand the culture in Topeka, this bill's going to pass. In fact, I think it's going to pass with veto-proof numbers. So let's be pragmatic. What do we really want here? I think if we understand the nut of this bill is it drives towards transparency, accountability, and accessibility. Taxpayers want to know who's raising their taxes. And I think that the very genesis of this bill is a disagreement over what a tax increase actually is. Governing bodies for a long time have said, we didn't raise the mill levy, therefore we didn't raise your taxes. But they know the assessed value goes up, the dollars also goes up, even if the mill levy stays the same. So they're defining the word tax increase to mean more dollars. And I think we need to move off that point. I think that, again, they're putting out lots of information out there that says that, you want to go out, let me just summarize what they've said here, that since 1997 to 2018, I guess is the numbers they came up with. They said that the Sedgwick County has raised taxes 103%. I don't personally think that's fair. I don't think that's the right calculation. What they're trying to say is our dollars have gone up 103%. But how much of that is understandable? Consumer price index or inflation has gone up, I believe, 64% over the same time frame. So in reality, we do have a slightly bigger government, and I think we can explain that. We're providing more services. We have more infrastructure. Health insurance has gone up. We have more employees. We're doing more things than we were back in 1997. So I think we can explain that and stand up and own it. I'm not afraid of an explanation that explains why we are higher than the consumer price index. I think we as elected officials we need to be able to explain that satisfactorily to the people we serve. So I'm not scared of that personally. So to the 5 points you named here, I think that if we wanted to come across, and I've said this before, we need to say up front we're a proponent of the bill. I know it's uncomfortable for some people, but I think that's where you get your audience. I think we ought to ask for some reasonable changes. I think to change the date to 2022 is reasonable. And it comes down to the changes are significant enough in this bill that we can't possibly roll with the punches here. We've got to have, we need a little bit of time to implement the changes they're talking about here. They, in the legislature, may receive this request as a stall tactic. And I would like to let them know, we're not trying to stall. We really do need the time. We don't have a plan, we don't have any plans of trying to repeal this next year, okay? We simply want to make it workable. And logistically, 2021 is not a way we can do this. We have to have a little bit of time to implement the changes of this bill, because it's significant. I think they'll be receptive to that if we're a proponent versus an opponent. So just my free advice there. And then in terms of cost of mailing, I think a lot of the people who are going to vote for this bill, they understand that we don't want to add cost to government. $150,000 is a lot of money. I think we can compromise. If we simply say, just go to the website and you'll find it, I don't think that's satisfactory. I don't think they're going to be happy with that. But I do think if we were to advocate for a mailing that is generic rather than tailored for that property, letting them know that this information is available online and where to go to find it. And if they don't have access to the technology, they can call a phone number, and we can get them the information in writing if we need to. But I think that the generic postcard that directs them to this information would be, in my opinion, a much more conservative way to do this. Again, I'm not trying to say we shouldn't mail something, but rather than have it tailored for each property owner with all the details buried in that piece of mailing, that's a very complex mailing. And I think that that's going to be hard to mail out. But I do think a generic postcard alerting them that this is an opportunity would be welcome. Second of all, anybody that doesn't have technology, doesn't have the ability to see that information, we ought to be willing to send them the information. So I would suggest we send that postcard. I think, as again, the compromise would say, let's send the postcard for 3 years, every year. And at the end of the third year, we'll cease from doing that. But anybody who would want to opt into a continuous mailing could opt in or subsequently opt back out again. I think that would be reasonable. And when they opt in, they would get the same information you would get if you went online. And online, there should be available, every taxing jurisdiction that's available, they should say that applies to that property, and their historical mill levy and their historical tax collections for that property. That's the information that should be available to them. So to me, avoiding $150,000 expenditure makes a lot of sense. I think everybody in Topeka would get that, but they don't want to avoid the fact that we need to be transparent, accountable, and accessible. That information must be available to them. And what they have right now, I'm a frustrated taxpayer too. What we have right now available to taxpayers, it is difficult to get the information, and it is difficult to understand the information. So I think we can do better. I think the My Local Taxes is a great utility, so we could probably build on that to make this much more usable to the taxpayer. I completely agree that moving the 9/10 date back to whenever we need to do that to adopt that change, or I should say adopt whatever spending levels we need to adopt, that makes sense. We need to be able to receive information at that hearing and have time to make changes. Again, I would think they would agree with that. And then providing certified budgets, I think you need to have whatever time you need to do that should be allotted to you. So I agree with all the things you suggested. I think number 2, the mailing should be amended to be something a little bit more between doing nothing or simply just saying go to the website or look in the newspaper. I don't think those are adequate. I think we need to mail something out. And the last one, I disagree with you respectfully, but I would tell you this, again, the nut of the bill is that when a governing body accepts more tax dollars, that the people have a right to know what's going on. What is that extra money going to be used for? Why do you need it? I think that, again, if we were to oppose that, you lose the audience entirely. I think we need to understand that every governing body is going to likely capture some increase in their budget from year to year. That's understandable. It's rational. I can explain it. I think everybody, understands it generally. At the end of the day, we have to stand up and explain it to our taxpayers. Exactly why is our budget higher this year than it was last year? Maybe it's we're providing a new service. Maybe it's we're doing something, we have health insurance costs more. So it just makes sense that we should be able to stand up and explain that and ultimately vote for that. That's the nut of this bill. So again, if we oppose those changes, we will never have an audience in Topeka. So pragmatically, I think we need to amend our position as a board, and I would ask my colleagues to support this. Please eliminate number 5, because I think you lose entirely our ability to be heard in Topeka. We should modify our position on number 2, and I completely agree with you on the other 3 points you made there. And I would let them know in our testimony, we're not stalling. We simply need some time to implement these changes because they are very significant changes to how we do business in Sedgwick County. And we have no intention of trying to ask for a repeal of this. We simply need time to be able to implement the changes that this bill would require. That's what I would have said in Topeka had I had the opportunity. Unfortunately, they had this hearing on January the 13th, which was almost, I think, day 2 of the legislative calendar. So didn't have a lot of time to respond to that. So I missed my opportunity. I would be glad to testify in the House. I would rather do this as a representative of this commission rather than as a representative of myself. So I ask my colleagues to please consider these points. I want to be successful at the end of the day. If all we do is do what we're doing now, we will never have an audience. We're not going to make change in Topeka. We can do better. I would ask Jason for his comments as well. Thank you.
Jason, you've been invited to comment. We've got a couple other comments from commissioners if you want to wait, or you can comment right now.
I can wait until the other commissioners have commented.
Commissioner Lopez.
Hello, thank you. So I just had a question about the software update that you had mentioned. The software that we use now, is that hosted by the state or is that something the county runs individually?
So this is really more the county clerk's territory, so I'll do my best, but I
Okay.
will invite them to correct me by
Okay.
email afterwards. That is something that the county individually runs. We do have a certain template of information that we provide to the clerk's office to provide to the state, but their actual system to administer all of our tax processes is hosted here and run by Sedgwick County.
Okay. Do you know if our software that we use now is going to be able to even do the changes that are being asked, or are we going to have to set up a whole new system going forward?
My understanding is that it will do it, but it's going to take quite a bit of programming effort. And so that is why the clerk's office is joining with us to say yes, but a delay would be useful because they have serious concerns about whether they can even get it in place in time
Yeah.
to do what's necessary here, since these mailings have to go out roughly starting July 15th.
Yeah, that would be extremely hard to do that in that amount of time. I guess I know it's probably not possible because we'd have to get everybody from the different counties to kind of sign in, but would it be possible in any way that we can do a statewide program where we host like a web server that we can all hit, and then that would save, I would imagine, quite a bit of money overall between the counties? And then also, if the state is pushing us to do this, are they going to help pay for any of this programming? Because I can't imagine that would be very cheap.
With regard to whether a statewide program could be done, I will have to defer to the clerk's office on that. I don't know if there's interest. I believe a lot of those folks are independent elected officials, so I don't know. It is hard for me to guess whether they would like local control or whether it would be more advantageous to have like a single software that can handle it for everybody. I think there's pros and cons to both of those.
Right.
With regard to your second question, I think certainly we can make anything happen that we need to.
Okay.
So if that's a cryptic enough answer for you, we will do the will of the commission.
Okay, because I would imagine if this was not planned for, we probably don't have it in the budget as it is.
No, I don't know that the state would ever be willing to fund it. I don't don't know if it would be worth asking. I know Commissioner Howell has had experience at the state. Typically, these are what we like to call our unfunded state mandates. In the old property tax lid, we were allowed to have exceptions if we had those extra costs. No, the state, I don't believe, has signed up to pay for any of this. But I don't, again, if you want to ask, we will do what the commission directs us to do.
Okay, thank you.
Okay. Commissioner Cruz?
Thank you, Chairman. In regards to point number 5, I guess I need to make the connection between how adding something isn't being transparent. Because I feel like when we're adding things, having the historically allowed adjustments there, to me, is being transparent. Correct me if I'm wrong, Lindsay. How are we? Because we just want to know how the property has been, how the rate has been adjusted in the past. So if they do improvements to this, or if more services are added to this location, say they add, it develops into a property, and now we have to provide all of those services that we would provide to everyone else, that would increase costs. So having that historical data, I believe to be important. Can you help me understand how it, or I'd like to hear actually from Jason, what his thoughts are about having that. Jason, would you mind adding in how number 5 would impact this?
Yeah, and I'm listening as good as I can, but I'm having a hard time hearing the commissioners talk. So, Mike, tell me number 5, since I can hear you.
5 was the discussion that we've had in the past, Jason, about allowing historically allowed adjustments to calculating the revenue neutral rate. These would include the value of new improvements and property that has changed in use, improvements to property, something to capture the increase in growth in the county, which we would have to provide additional services. That's what we're talking about.
Yeah. So I know there's been a lot of focus on the effective date, just kind of based on concerns that both Lindsay and the clerk have. But that point, number 5, is probably the one that I think is generated the most discussion. And I will tell you, while I agree that the date needs to come back and there's plenty of changes that need to be made in this bill, that point number 5 to me, just on a personal level and as a former elected official, is the one that's the most troublesome. Unfortunately, the answer that you get back from the elected officials that are supportive of this, and keep in mind, I think if you had a chance to read my report, there was one member of the Kansas Senate that voted against this. So this bill has a lot of support. Unfortunately, the response that you get back from the legislators is, well, this isn't telling a county that they can't collect that revenue. This is just telling a county that they have to send out the postcard or the letter, and they have to hold the hearing if they're going to collect that revenue. I've used the example over and over again that if you have 100 properties that bring in $1,000 in revenue, and then the next year you have 110, then isn't it reasonable that you should be able to bring in 1,100? And I know those numbers are not what we're talking about. It's just by way of example. But again, the answer that you get back is this doesn't stop any county from collecting that. You just have to let your citizens know, and you have to hold the public hearing. I'm not saying, let me be clear, I'm not saying I think that's a good response from our elected officials. I'm just saying that is the response. So I don't know if that answered your question or not, Commissioner.
I appreciate the explanation. I guess when we add information into something, I believe that to be more transparent. So to leave things out, I guess I'm just not making the connection how it's being transparent if we're leaving info out. So that's all. Thank you so much.
Thank you.
Well, if I could, Mr.
Yep.
Chairman.
Go ahead.
I mean, I obviously this bill is being talked about as being about transparency, but make no mistake about it, this bill is also about trying to keep property taxes down. So while everybody is for transparency and probably everybody's for keeping property taxes down, I do think it's important that figure out how to say this diplomatically. Some of the arguments that we're going to receive, or some of the feedback that we're going to receive on the points that we're making, might not always exactly match. What I'm saying here is this is intended at really every level to not just be about transparency. It's about trying to keep property taxes down. And so while some of the arguments that we make perfect sense, unfortunately, some of them are falling on deaf ears.
Right. Jason, when you say property tax, I've battled with this for 5 years. It's really property tax revenue. It's not the tax, it's the revenue that that they want to hold back. Because that's,
it's not the tax rate
exactly. I'm just
that
clarifying.
Legislators are taking the major issue with. It's that increase in valuations.
Right.
That if my house was worth $165,000 last year, and I paid X number in property tax, and I did nothing to my house. I didn't add land. I didn't build a garage. Whatever. Because of my valuation, I paid more property tax this year than I paid last year. That's what the anger is about.
It's kind of a anti-improvements bill, but that's all right. So so we could accept Lindsay's letter as stated, or we could, as you've said, Lindsay, number 5 is kind of a pie in the sky, and it might be a little bit difficult and might hurt our message. As much as it's, as Commissioner Cruz, it is transparent to the public. If it's detrimental, I kind of lean towards if we go with just 1 through 4, and as Commissioner Howell so broadly explained, that it'll be up to him and us to explain to the public to justify that and not to hide from any growth and blame it on the growth. It's be up to us to explain, hey, there's been growth. We've taken a dead building and brought it back to life, and it used to be worth $1,000 a year, and now it's worth property tax of $10,000 a year. So we have to justify to be able to accept that to help provide services. And I would, as much as Commissioner Howell is asking us to support this, I'm going to ask him to be eloquently prepared to be publicly defending any growth that's what we would consider as legitimate tax revenue. So Commissioner Dennis has not weighed in yet, but, and this is not a formal vote. I know you're kind of taking a poll based on the feedback that I've heard and the emphasis on a little bit of pie in the sky and the emphasis and what Jason has just said. I would maybe keep your letter in the form of 1, 2, 3, 4, and we submit that way. Commissioner Dennis, you have not weighed in. I didn't mean to go in front of you. I'm just saying it while it was hot on my mind.
Thank you, Mr. Chairman. I appreciate the chance to provide some feedback. I believe that we need to tell the legislature what our concerns are with this bill. If we don't tell them what our concerns are, we're not going to get anywhere. It may fall on deaf ears. We can always pray for the best, but we're going to have planned for the worst. So as a result of that, I don't have a problem with submitting the letter as written. Thank you, Mr. Chairman.
Okay. All right. Thank you for your comments, Commissioner. I'm okay with what you've said as well. But
if I could jump in,
Sure.
Jason, do we have any idea how quickly this is going to be considered by the House Tax Committee?
It was supposed to be considered this week. It's possible now that it gets moved to Thursday, but it's also likely that it gets moved to next week. They've canceled not everything, but they canceled almost everything for today and tomorrow, and playing it a little bit by ear on Thursday, just based on what happens up here.
Do you think this is going to sail through the tax committee as quickly as it did the Senate committee?
I don't. I think we're going to have more opportunity with the House Tax Committee to hopefully get some of these changes to be adopted. You know, when we were talking with certain members last week, it became pretty apparent that the Senate tax chair wanted to get this through without changes right away. So I made some comments earlier, and I wouldn't want anybody to mistake those as that there weren't some members on the committee that were sympathetic to some of our concerns, but I think the orders were get this through. This can all be either dealt with by the House or dealt with in conference. And again, that's not a guarantee that they adopt our changes, but the answer to the question of is our probability higher in the House? Yes, I think so.
And I think we didn't have the opportunity last time because everything happened so quickly. Do you know how the House is conducting testimony? Will we have an opportunity to have the chairman or somebody else in the commission testify either by WebEx or otherwise to state some of our oppositions or support with changes, however we want to do that?
Yes, it'll be, so I believe Commissioner Howell came up and testified on this last year and testified as a proponent, but also suggested some changes. Now, this bill wasn't retroactive last year like it is this year, but that same opportunity will exist either to come do it in person or do it via WebEx.
I think we'd probably, and Jason can chime in as well, I think it would probably be more, last time because of time constraints, we had our CFO submit a letter. I think it would be more impactful to have somebody from the commission weighing in, chairman or otherwise, on this bill. And we will try to get, if this is the will of the commission, to go ahead and support the points that Lindsay has already made or want to detract from those in one way or another. I think we need a commissioner to weigh in, so.
Okay. Well, is this something that you can talk to each commissioner and weigh in, and if it's the letter as is or if it's the letter adjusted, and then we fill it out or complete it and send it? That'd be all right?
We can certainly get the letter out. We can, and we can also prepare testimony for you or another commissioner to testify, and Commissioner Howell can testify, an individual commissioner too, if he's, I know he has specific changes he'd like to make and he doesn't support number 5. So we can do it we could have a couple of commissioners end up testifying in the bill, so.
Jason, Commissioner Howell has a question, but if item number 5 is still in the letter, you think that destroys any position that Sedgwick County weighs in on?
I don't tend to think that it destroys the ability to move forward with points 1 through 4 if 5 is in there. And it sounds like you have made the decision that you want to be supportive. I think Commissioner Howell mentioned this earlier, and I would agree with him. Your probability of success on any of those points is going to be higher if you're seen as coming in as friendly. It's not at all uncommon in the legislature for somebody to come in and testify as a proponent or testify as neutral, meaning that they're not testifying against it, but to say, hey, I'm supportive, but these changes would make it better. These changes would make it more manageable. You know, we agree with the overall goal. Nobody wants, runaway tax valuations and, revenue that revenue collection that outpaces, whether it be CPI or whatever. I think it does make sense to go in as friendly as possible on this and say, but these changes help us all accomplish what we're really after.
Okay. Commissioner Howell?
Thank you, Chairman. Just want to say, I guess I want to ask Jason just to make sure we're on the same page here. Number 5 was the calculation that would give us, if you will, a slightly higher cap based on consumer price index, new annexation. That doesn't really apply to counties, of course, but new construction and population growth. So we would calculate, if you will, a higher cap that would trigger the notification process. That's what number 5 was. Is that what you understood, Jason?
Did you ask me if that was my understanding of what number 5 is?
Because when you comment about number 5, I want to make sure that you understand that's what we're talking about.
Yeah, and there's a lot in number 5, and so I think it's important to understand that there's probably some things in number 5 that some people will be agreeable or sympathetic to, while others will not. There's not a huge appetite for including CPI, whereas some of the legislators I've talked to think it makes sense that, if you have a new commercial development, if you have a new large residential development, well, certainly you would need to take in more revenue to provide services to that area. I think that is probably more agreeable to folks than CPI. And I'll go back to the tax lid. This bill repeals the tax lid, and I know local units of government are happy about that, but so are the folks that championed the tax lid, because there were so many. They believe there were so many exceptions put into that it was basically rendered ineffective. And so CPI is something that the folks concerned about property taxes are not very keen on.
Okay, so thank you for your comments. Again, I'll stand by what I said earlier. I think if we start trying to calculate what we consider to be reasonable growth as a way to not trigger this notification, I think that's where we lose any audience in the legislature. Let me just say this, Americans for Prosperity has done a lot of public studies on this. This is one of those issues that is at least a 75% supported by the taxpayers. This is again, if anybody doubts me, I'll be glad to make a friendly bet with you, but I really think this is going to go through the legislature, probably one of the very few bills that's going to pass with very, very strong support, probably veto-proof. It's going to pass. So we have to be very careful with what we ask for. If the most important thing is the mechanics of this, which is incredibly important, I think we should focus on that, because as is, it's not workable. Let me go back to that point. But if we're trying to find a way to wiggle out of this notification, that we're not going to have an audience in Topeka. So I want to be successful at the end of the day. Sedgwick County has been great in the last few years at being effective in the legislature, pushing forward reasonable ideas and good legislation. I think we need to be pragmatic on this. And I would be very glad to represent this commission, but I plan to at least submit testimony, if not testify. I think we need to understand this is going forward. I want to be successful at the end of the day in fixing the real mechanical problems of this bill. But if we're trying to wiggle out of this notification by saying, let's calculate a higher amount of tax dollars this year, that's where you lose. Because the people that we're serving, it's a 75% issue, at least, if not higher. And back to the Commissioner Cruz's point, what I think, I guess the way I would have answered that question is it reasonable to have more tax dollars in our budget based on there's more people that we serve, the population growth, there's new construction, consumer price index, inflation as things are more expensive. Those are reasonable things. And again, I think we can stand up as elected officials and explain that to people. That's our job, is to explain that. But the reality is, they've termed this an honesty gap, because what's happened in the past is we define tax increase differently than what the legislature is defining tax increase. Most people would say, if you take in more dollars next year than you took in the year before, that's a tax increase. That's very basic. That's the basis of this bill. We can explain it and say, well, yes, but we have more population we're serving, we have a larger area, we're doing more things, things cost more money. Again, we can explain it. But the reality is, we have, as governing bodies across the state, as elected officials across the state, they earn this criticism a little bit when we say we've not increased taxes. When in reality, our taxes have doubled in that 20-year period. Our tax dollars, I should say, not the rates, but the tax dollars have doubled in that same time period. So we're pointing fingers at each other about terms and definitions. The reality is they're trying to create some transparency and better understanding by the taxpayers on exactly why those increases are happening, make us stand up and vote for it and explain it. And for that, accountability and transparency and accessibility to data information that our taxpayers need, this is a good bill. We should stand up and say it's a good bill. So we ought to be proponents with very necessary changes to this bill. That's how we're going to win. But if we simply oppose it and send that letter out as is, we're not going to win. So I'm very passionate about this. I hope I've convinced my colleagues that if we want to be successful, we need to come off number 5 especially. But I'll just stop with that. Thank you, Chairman.
Okay. Just before Commissioner Cruz, using words like we are not trying, I'm not personally trying to wiggle out of a notification being mailed. Those are your words that we're trying to wiggle out, and that's totally incorrect for the record. I'm totally okay with being transparent and informative. I am not trying to wiggle out. So thank you for that. Jason, I have a real quick question for you, and then Commissioner Cruz. So we are not, we're one of 105 counties. Every county is going to have the problems of 1 through 4, every one of them. So if we were just neutral on this and didn't even comment and let it, everybody's saying it's going to fly through, and it just flies through, I know it's going to be a lot of stress on every county clerk. But if it flies through, I don't know why we need to show up and say, hey, we love this thing, we propone it, and by the way, can you just change this or that, when the other 104 counties may be being an opponent of everything we're talking about. So in a way, if we just let it go and be neutral, then we can be neutral. Commissioner Cruz, you have a question or?
Yeah, I think it's important to understand that we sit on this board as the 5 of us, and when we have something that we are considering as a board, it's important to understand that the majority rules even on this board. And when we talk about, I've heard from Commissioner House, I think he said it 3 times now, that this is going to pass with flying colors, it's going to be veto proof. So for us to have these things in here stating, if it is the will of this commission to have all of these 5 points, what is the best way to communicate that to our legislature when, as commissioners, we sit on this board, we've made this decision together? How does it harm or hurt our position when we have one commissioner who doesn't agree with what we're trying to accomplish as a board? And so I would caution us in understanding that when we are making decisions on behalf of our taxpayers, it's important to understand that we all want the best. Nobody wants to raise taxes. And to listen to our financial folks who have done this for a very long time, that's where I'm coming from. I think it's important to understand that when this decision is made as a policy position of the current BOCC, we need to understand that that's what this will of this board wants. And I think that we need to respect that as commissioners sitting on a board together.
Okay, thank you. Commissioner Lopez?
So it sounds like the board might be split on this one. So since everyone else is kind of giving their opinion, I would just throw out that if we could talk maybe after this so I can get a better understanding of everything, and so I can have all the information before I can really make a decision on where I stand on that, I would appreciate it. And one more comment, and I don't mean to harp on this, but I don't really know. I'm still learning kind of how our IT is done here, and I completely understand that if anything were to try and get people to come together, that it would have to be agreed on by everybody. But who should I talk to about seeing if even we could do a pilot program with some counties and see how much that could possibly save between them, or how much any of this program cost annually, or going to one vendor? It just seems like it would save a lot of money between the counties.
I think for probably this initial round, since it most impacts the clerk, that's probably where I would start.
Okay.
With the way our system works, we actually have what's called the tax steering committee. And so it is made up of all of the different electeds and appointed officials who weigh in on the tax system. They actually just met last Friday. I haven't been able to go for a little bit because of some CARES stuff that we've had going on, but that group probably would ultimately be the one that would probably have the full range of knowledge. It also involves IT, of course, so they could probably give you a better idea of what the pros and cons could be from their perspective.
Okay, yeah, that would be great. How often does the tax steering committee meet?
About once a month, but I think if there was a particular burning issue, they could probably be incentivized to meet, especially.
All right, thank you.
Okay. Jason, can you give me your feel if we were just neutral, just for my understanding and maybe the others? Putting you on the spot a little bit, I understand.
Ask that again, Chairman.
Well, I'm kind of putting you on the spot, but you're a lobbyist. If we were just neutral on this and didn't submit anything, what would be the impact from your opinion?
I think you would have less opportunity to be successful in seeing some of those changes that you want made.
Okay.
If you didn't weigh in. We've mentioned a couple of times that there's 105 counties in the state of Kansas, but Sedgwick County is the second most populous county. It has some of the largest economic drivers to the state's economic engine, and it's been very, very active with the Kansas legislature, whereas, there are counties that, and, not disparaging those counties, but they have 3,000 people. Their commissioners don't come to Topeka. They don't have a government relations team. So Sedgwick County, and in no way am I saying we're always going to get everything that we want, but because of our size, our population, the contributions we make to the state general fund, and our legislative activity, we are listened to. So certainly the probability of getting some of these changes made is going to be higher if we participate in the discussion versus not.
Okay. Thank you. That's helpful to information. Okay. So where we sit.
Certainly, Mr. Chairman, I can talk to each of the commissioners individually or in twos, and we can come out and continue to working with Jason and come up with some testimony for you or some other commissioner to give to the committee. And I'm sure we can work through the issues surrounding number 5.
Right. So that seems to be the point of interest.
And it may be just defining more under 5 what we really mean, making it more reasonable than as broad as it is right now. So,
okay.
I do think, if I can interrupt, I do think that particular conversation will be useful. What we're referencing in number 5 is actually what had been in place for a lot of years before the property tax lid. It doesn't include CPI.
Right.
It doesn't include a lot of those adjustments. It's really just 4 bullets from the old law. And so I think maybe if we can articulate that a little bit more, it may be less controversial, although still if the commission wants to take it out, it's not a sword I think anybody needs to fall on.
Okay. All right, Lindsay. Okay. Any other comments? Commissioner Dennis, you got anything else? Another comment?
Thank you, Mr. Chairman. My only comment is that I think we need to take a commission position on this rather than being neutral, because if we don't, I know that And with all due respect, any one commissioner can have a different view from any of the rest of us. But if we don't, and we have one commissioner go up and take a position that is not the position that the rest of the commission agrees with, then it's going to sound like it's the commission's position. So I do believe we need a commission position on this entire bill. Thank you.
Yeah, thank you for your comment. I just threw the neutral question out there just for to see what the opinions would be. So I think neutral is out of the window, or out of the question. Okay. Don't see other comments. Tom, we have anything else? Okay. All right. Well, we will adjourn today, and we'll be at the commission meeting tomorrow morning. Thank you.